You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall. Welcome to the Dental Zone. I'm a holistic dentist from Brisbane, Australia, and today I'm going to talk to you about, is replacing amalgam fillings dangerous? If you've been tuning in to my latest episodes, you know that we're talking about dentistry without mercury, been talking about the research, the toxicology, the implications of amalgam fillings and the mercury components with them on your health and well-being. And we've looked at what materials and alternatives you can have instead. If you'd like to know more about holistic dentistry, then hop on over to holisticdentistry.au. But for now, let's get in the zone. So, is replacing amalgam fillings dangerous? Well, the answer you're going to get depends on who you ask. If you ask the ADA, the American Dental Association, they'll say yes, it is dangerous. Their official position paper published back in 1984, which hasn't really changed much in that time, and it was published in the Journal of American Dental Association. The association wishes to emphasize that, except in individuals sensitive to mercury, there is no reason why a patient should seek at this time to have amalgam restorations, silver fillings removed. Indeed, the effect of such a procedure and further restorative operations could be detrimental to the patient's oral health, including the unnecessarily loss of teeth, and cannot be justified. And as I said, their official position is still the same. I believe that statement is intended to scare any individual or any patient who reads it into changing their minds if they were contemplating having their amalgams replaced. Now, if you ask your traditionally trained general dentist, should I get my amalgams replaced? They're going to tell you, no, there's nothing wrong with them. They don't need replacing, the fillings are fine. And okay, I can get that. I see that. I have patients come for general checkups. I'm not banging on to them about getting their amalgams replaced. I will touch upon the subject of mercury, but it is for them to reach their own conclusion. So I would say, yeah, I agree. You don't have to have them replaced, but that doesn't make replacement dangerous. You will then have that dentist who, if you say to them you're concerned about the mercury, will kind of poo-poo that, tell you that they're completely safe, that, you better not stirring them up, leaving them alone, and so forth. And they're the ones who are not true here. The problem is that if you've got a dentist removing amalgam who's not aware of the dangers of mercury exposure and well-trained and qualified in the procedure to protect you, the patient, then there are going to be problems. Because when you drill on an amalgam filling, you release mercury vapor, mercury dust, particulate, and that goes up in the room, you inhale it, it lands on your clothes and skin, you absorb it, you swallow it, and you ingest it. And you can actually directly absorb it through the tissues of the mouth. So yes, it's dangerous if it's not done properly. But dentists routinely remove amalgam fillings every day, and then they will either replace them with other amalgam fillings or other materials. So you have to assume that the ADA is saying it's still all right to replace amalgam with amalgam, but it's harmful to replace amalgam with composite. Freaking lie. No, it's not. Composite fillings are very, very safe and non-toxic and biocompatible. Now, the average lifespan of an amalgam filling is 5.5 to 11.5 years. In 6-year-old children, the average survival time for occlusal amalgam fillings, that's on the bite surface, was 26 months. Most fillings are replaced because of decay under the filling, excessive corrosion, fracture of the filling, or cracking of the tooth. The procedure is so commonplace that like your health insurance will pay for replacement of an amalgam filling after only 1 year. So if you had one done last year and you needed another one this year, your insurance company is not going to say, oh, but you only had that done 12 months ago, we're not paying on that. The primary risks to patients' health are the competence of the dentist, and the statements being made by the ADA cannot be supported with primary scientific research. There are certainly situations beyond the control of the dentist which may mean you lose a tooth. However, the newer materials that we use, the composites and the porcelain, are so much more flexible and advantageous to work with that in many instances teeth can be saved that would otherwise be lost if amalgam was the only material available. There are limitations to where you can place amalgam. It doesn't stick. It needs walls of tooth around it to be able to stay in place. There are special techniques utilized by a holistic dentist to remove amalgam fillings, and if it's done properly, there is minimum exposure to increased levels of mercury vapor caused by the removal procedure itself. However, I feel it's important that you, the patient, need to be aware of some certain aspects related to amalgam removal so you can decide if the dentist that you are choosing to replace your amalgam fillings is actually going to do it safely for you. Your bog standard general dentist on every street corner is not trained to safely remove amalgam. They will just numb your mouth and drill on that filling without any care or concern to you or their safety. These are things you need to look at. The dentist should have an assistant present to assist in minimizing their exposure and yours to any mercury vapor. The correct protocol requires the use of high volumes of cold water, both from the drill and irrigation methods. And we should be using high volume suction to evacuate the vapor and particles resulting from the procedure. The assistant should hold the high suction next to the tooth being worked on until all of the filling has been cut and the cavity has been cleaned. Now, this should not happen unless there is a non-latex rubber dam in place. You are provided with a nose piece with some clean, sterile air coming through, and we use an air filtration machine with a trunk or tubing that sits close to your chin. The assistant and the dentist should also be wearing respirator masks and coverings to protect themselves. Now, there are special tips that can go on the end of the suction that cup around the filling called a clean-up tip, and that goes directly over the tooth being worked on, and it provides continuous evacuation of the work area and during the entire removal replacement procedure. It's very effective in removing the mercury and also at removing any particulate and aerosol, and gives additional infection control. Imagine we were taking out asbestos. We want to really limit the spread and how far it can go. This can be used during the composite placement as well to keep the areas clean and dry. So there's things that need to be in place to ensure that you don't swallow, you don't breathe in, and you don't get splattered with amalgam inside your mouth or on any of you. And the dentist and the assistant need to be having things to look after themselves as well. It is really critical to keep things clean and dry during the process of both the removal and the placement. It's the volatility of mercury that necessitates all the precautions and correct techniques. Mercury vapor pressures doubles with a 10 degree centigrade rise in temperature. Now, our drills go very fast. They grind on the filling and they would generate temperature increase. So we need to section out the amalgam into chunks and not just grind on it. So we use special dental drill bits that do that break up the amalgam. They do kind of bounce and vibrate a bit more than the normal drills, but I would rather have that and have a bit of kick going on from the drill and get those fillings out in big chunks. The dentist should ask you to breathe through a nose piece that permits you to draw air that is not from the actual dental room. The dental assistant and the dentist are at greater risk from exposure to mercury aerosol spray and vapor, and they should be wearing special clothing, masks and surgical gloves that protect themselves from excessive exposure to mercury during the repeated removal operations that they perform. The dentist should be using a rubber dam during the procedure, which is a square, and we use non-latex rubber because it stops the passageway of mercury, whereas latex doesn't. So it's a square of non-latex rubber that's stretched over a frame that isolates the tooth or teeth being worked on. It prevents you from swallowing the ground out mercury amalgam particles and accidentally inhaling fumes. There have been some studies that show that the mercury vapor has been greater under the dam, and that's because we were using latex. So if your dentist does use the dam, try not to breathe through your mouth. I mean, even with these good dams, but we also make sure we put a small suction in underneath to mitigate any potential passage of vapor between the tooth and the sheet of dam itself. The office should be well ventilated, as is, and many mercury-free dentists are installing central vacuuming systems. So we've both got the portable vacuuming system that we put next to you, but as well as our air conditioning, we have a recirculating vacuum system up in the ceiling that helps draw the air through and out very quickly. So we've got clean air circulating into our rooms at a higher rate than would be normal. So we get that portable system, and we call ours Jumbo because it's got a big trunk on it, but it's called a HGIQ Air Vac, and we put that vacuum just on, above your chest, under your chin during the removal process, and this provides an additional high vacuum suction source. It draws out the mercury vapor and it draws out the aerosol during the removal process. So it's a really good way of ensuring your safety and the safety of the dentist and the team. The ability of mercury vapor to absorb to many different surfaces is causing many of us mercury-free dentists to now consider what the background levels of mercury, particular in the dental office, might be. And that's why we're using our air purifying systems that I've talked about to eliminate or greatly reduce these background levels in the operatory. Now, I don't want you to be in a hurry or in a rush to get your amalgams out. Now, the research in the past used to say it was better to replace only a few amalgams at a time with several weeks in between appointments. And regardless of the precautions outlined, some individuals can experience reactions to the mercury release during the removal procedures, and most of that's coming from mercury that's being pushed out of your own system, not what you're being exposed to at the time. And these can be described as flu-like, can last from 1 to 7 days, can include fever, nausea, headaches, and it's basically a detox process. So it was said originally, maybe we should go slow and steady, do sequential removal of amalgam fillings, and look at it as a slow and steady process. These days, the research has gone a little bit more full circle, and the advice is to remove as many amalgams as we can in each session, and to get them out of your body as soon as we can, rather than doing this more drip-feeded approach. Now, if you've listened to any of the earlier podcasts or seen videos or read any of my blogs, I've touched upon sequential removal of amalgams, which was based on reading the electrical microcurrents of each filling and then replacing the amalgam with the highest negative readings first. Well, that was very in vogue and de rigueur during the 1990s and the early 2000s. But there's actually no scientific data to support the use of sequential removal. There's absolutely no scientific statements or data, that uphold the statement of sequential removal, and that if your dentist doesn't remove it sequentially, it's going to cause more mercury to remain locked in your tissues. That's just not true. It was something that was fashionable and everybody jumped on the bandwagon and did, but there was no science behind it. It's well established that precise measurements of these electrical potentials is not possible, and measurements of specific points on the fillings, which is not the entire fillings, and can't there be compared to each other. If your dentist wants to replace your amalgam sequentially, there's no problem with that, but there's no prerequisite for a successful amalgam replacement. And look, most dentists now, we replace fillings by quadrant, usually starting with the quadrant that has the largest fillings, removing the largest source of mercury first. And that's certainly how I work. I'll work quadrant by quadrant or half mouth, depending on how many fillings you've got and where they are and the size of them. Also on how long you can stand being in the chair and what your finances will permit as well. If you're going to be numb, say I'm numbing up the top right hand side of your mouth, I'm going to numb with one injection 4 of your back teeth because of the nature of your nerves and anatomy. I'm going to have all the safety equipment out. It makes sense to me that while that's numb and we're in that area, if you've got 4 fillings, 1 in each of those 4 teeth that are all numb, we do them at the same time. We get rid of the mercury burden from that part of your mouth, and that side, that corner is done. It makes no sense to me to keep coming back over and over, having an injection in the same spot, paying for all the procedure, paying for all the safety equipment over and over again when it can be done at one session. It's a better use of your time, and you're having to travel backwards and forwards, be away from work, etc. And it's a much better use of my time as well, if I'm honest. So the way I do it is we go, that quadrant or that part of your mouth, that's got the largest and the most fillings. Let's start there, unless there's decay, pain, or problems that would predict that we need to start somewhere else. Now, these electrical currents from metal fillings in the mouth do result in the movement of metal ions, with resulting deterioration of the amalgam filling and an increased release of mercury from the amalgam, and that can also cause pain. Although the electrical current of one filling cannot be immediately compared to that of another, contrary to the laws of physics, the severity of an electrical charge of individual fillings can be determined. To do so requires determination of a combination of the electrical factors, which are the electrical potential, the voltage, and the current flow from one point to another, which are the amps. Such a measurement can be done with an oral potential meter, but like I said, I don't actually think it's necessary. I think it was just something that holistic dentists did to try and convince their patients a little bit more that there was a problem. There are other steps your dentist is going to and should recommend to minimize or reduce the potential for aggravating any pre-existing mercury-related symptoms that you have, or for that matter, to make sure we don't cause any problems if you're already symptom-free. And these are normally nutritional and involve diet modification and taking certain supplements. The reasons are to reduce your exposure to mercury sources other than amalgam dental fillings, and to assist your body in coping with any exposure directly related to the removal procedure. Diet modification usually involves attempting to reduce the amount of mercury ingested from dietary sources by elimination or reduction of certain types of fish and other foods that normally have a high mercury content. Reduction of refined carbohydrates and sugars is also beneficial, as oral and gut bacteria seem to thrive on these types of food. Increasing dietary fibre intake is also helpful by inducing a faster transit time of waste matter and toxins to be excreted, as is increasing or ensuring there is adequate water intake to assist the body in flushing toxins through the kidneys. The nutritional supplements your dentist may recommend are those that scientific research has shown to either bind with mercury and help your body excrete it, or help your body to neutralize some of the biochemical byproducts created when mercury affects normal metabolic processes. This is a very dynamic area of research, producing new data continuously. So I'm not going to list the nutrients and their function, but I'm going to leave that aspect of the overall amalgam removal protocol to your holistic dentist or your physician, should you be under the care of one who has prescribed amalgam removal because of suspected toxicity. There are also therapeutic chelating agents and protocols available like DMSA and DMPS, and they're well-established mercury chelating agents that have been used in European countries for many years. They should only be used under the supervision of a qualified physician or doctor. An additional benefit is that they may be utilised diagnostically, like in the urine mercury challenge, to firmly establish a body burden of mercury. The medicinal textbook of environmental and occupational medicine indicates that sweat induction may also be of therapeutic value in reducing the total body burden of mercury. You can use sweat therapy to help, and this would include things like steam baths, saunas, heat lamps, and exercise. In Spain, I believe they've used sweat therapy on workers in the mines when they exhibit signs or symptoms of mercury vapor toxicity. So using sweat therapy increases the elimination of mercury through the skin and should help in reducing the total body burden. Pregnant women or anyone with a history of cardiovascular problems needs approval from their doctor before undertaking routine sweat therapy. Now, I said I wasn't going to touch much on the nutritional aspect, but I know you're all going to ask anyway. So I'm not going to give you the quantities because, again, this is all needs to be tailored to the individual. But as a generic rule of thumb, we would recommend things like vitamin C, B vitamins, minerals, particularly zinc and magnesium, because they get depleted by mercury, fish oil, and then dietary-wise, we want foods that are high in sulfur, so garlic, onions, green leafy veggies. We want things that are going to help to eliminate and improve your digestion, so lots of fiber, eating clean, good fats like avocado, olive oil, coconut oil, eating fish, but fish that's like sardines because they don't have a lot of mercury in them, and then good sources of protein and plenty of water. Basic, good, clean detox eating to help flush your body of chemicals. So it's really important that if you're considering having amalgam removal, that it's done safely. So to answer the question posed at the beginning of this podcast episode, is amalgam removal dangerous? Well, no. If it's done following smart protocols, safe mercury amalgam removal technique, and you can check to make sure your dentist is certified by going onto the website of the International Academy of Oral Medicine and Toxicology, where you'll find a list of dental practitioners in your area, and you can check that they're smart certified. Now, there's a lot of practices out there saying they're doing holistic dentistry. There's a lot of dentists saying they're doing safe amalgam removal. It's really important that you ask the right questions and find out whether that is completely true, because to be honest, a lot of them don't really know what they're doing. They don't have enough background. They are not certified, and they are just jumping on the so-called bandwagon. So please do your research. Make sure you find a well-qualified holistic dentist who is SMART certified and is going to follow all the protocols to look after your health and well-being. So done properly, amalgam removal is not dangerous. Thank you for joining me. This is the Dental Zone. I'm Dr. Rachel Hall. I am a holistic dentist in Brisbane, Australia. If you'd like to know more, check out holisticdentistry.au. If you'd like to book an appointment, then give my rooms a call on 0737 20 1811, or you can email info@holisticdentistry.au. Thank you very much for listening. If you would like to know more, then please reach out. You can always send me questions or ideas for future podcasts. I'm here to help and support you to understand your dental health, your oral health, if you want to put it that way, and your overall health. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.